Welcome to the Locum Strategist podcast. I am your host, Simon Parsons, and this is the show where we help physicians take control of their skill set and create a life on their own terms by using locum tenens as a pathway to making that happen. Today, I am very excited to have Dr. Victoria Mohr, who is an OB/GYN locum hospitalist who works with one of my recruiting colleagues. Dr. Mohr is passionate about working in global medicine, academics, high risk and high volume settings, and supporting her students around the world who are now leaders in medicine because she has the flexibility to mentor them. Dr. Mohr, thank you so much for joining me. How are you doing today?
I'm doing great.
So that intro shares a lot about you. You have your hands in a lot of different things, but I wanted to start out with just a couple of questions about your backstory, about how you found your way into medicine and locums. You and I were talking before we hit the record button about how you've been doing this for quite a while. So tell me a little bit more about your history and how you found your way into locums and how long it's been and why that's important to you.
Let's see. Um, you know, honestly, after I finished residency, like everyone else, I went into private practice, sat for my boards, and I was really, really struck by just the state of our medical system. And it seemed like there were so many physicians, kind of, all wanting the same thing. And one day I just realized that, there were places all over the world that just didn't have access to the amount of physicians that we do in the States, and combine that with a love of travel. And I started to work a little bit with your sister company, Global Medical Staffing in New Zealand. And that, along with having three nieces who are very, very world minded, just lit a passion for global medicine. And honestly, I just never went back. So I'm a career locums since 2007. um, I've been doing locums in order to make the time and support my global medicine and capacity building career.
That's incredible. So it's been about 18 years since you've started, and I think that a lot of things have changed in that time, I'm sure. What was it like? How did you hear about locums? How did you find your way into this that many years ago?
Let me see. I think I may have heard more first about global medical staffing, looking for a way to do something internationally. And then when I came back, I was in a personal space that didn't allow me to commit to one place or another. And I, just started. Actually, I was with six different locums agencies right at first. Like everyone, I was just, worried that, gosh, am I going to lose my skills? Am I not going to get work? Um, yeah, and it just seemed like a really good fit at the time.
Now, you mentioned that you're able to have the flexibility to help students around the world who are now leaders in medicine. Are you doing that through locums and working like assignments and sharing your knowledge all around the globe because of that?
I am. So I've started residency programs in developing countries, in several different developing countries, and oftentimes in a developing country, say like Cambodia, where there weren't OBGYNs when I started working with them, there are oftentimes refugees from different wars, seeking education and training outside of their own, less secure situations at home. So, for example, I have a Ukrainian student from from the Ukrainian war years ago that came to me as a trainee in Cambodia and is now running a women's hospital in Phnom Penh. A student in India who was one of my students in Qatar when I worked for the Harvard Medical System, setting up, helping modernize women's healthcare in the country of Qatar, who is now the government just opened a hospital for her, women's health hospitals. So I have these students that, I've seen since they were asking me basic science questions. And now they're, they're doing amazing things, which is just such a treat.
That's incredible, and I'm so glad that you brought this up because I myself, I've been in locums for about 11 years, but the people I work with are here domestically. The jobs that I work are domestic jobs, and you mentioned that global medical staffing is one of our sister companies, but it's incredible because I'm not really that familiar with what those assignments look like. So I'd love to hear from you to tell me a little bit more about this, both the audience and myself. I would love to know a little bit more about what are the major differences between those types of global assignments and the ones that you see from
Mm.
Comp Health or Weatherby or some of the more domestic type of agencies. What do people need to know if they're interested? Because I do get questions about that, but I haven't been one that's been that filled in, and I'd love for them to hear from you.
Oh, sure. Well, it's been a while since I've done anything like that, like 18 years actually to be it's exact. But I will say there were in New Zealand, there were holes in certain places in New Zealand at the time, specifically where midwives weren't communicating well with the consultant OBGYNs, and like that type of change leadership was kind of always been an interest of mine. So yeah, everything from licensing, credentialing, the same as we do in the States, to travel. The only thing is that the assignments are a little longer. I think, 6 months, 6 months for, no, that's Doctors Without Borders. Probably shorter time for surgical subspecialties, longer commitment time for if you're going to be seeing patients in the office and they're wanting you to cultivate relationships. But it was a great experience. And honestly, it was my gateway into global medicine because the language was the same, but the cultures were so different. And starting to understand how in different places in the world they look at medicine differently and the patient relationship differently, just really kicked off a career of curiosity into how the rest of the world works. And then, gosh, medicine, the rituals around birth and death are so rich that like having a front seat to those cultures and being invited in has just been, it's been a dream come true and a passion. And, whether it's locums out of the country or in the country, it allows me to chase those things as well as keep my hand in US medicine without the pressures that are here, without the politics, without getting burnt out. Because I love what I do.
Oh, I can tell, and you kind of give me some goosebumps. Back in 2019, I had the honor of being invited on a medical mission with some of our nursing locums, and we went down to the Amazon, and it was just such a magical experience. Like when you're talking about culture, and it is so rewarding. Now, when you're doing global locums, is it similar to like medical mission in the sense that you're typically helping underserved communities, or how would you um, how would you describe it in comparison with what a lot of people understand about medical missions?
Ooh, that's a good question. So I mean, my locums experience was very, very short and an entry. And I believe it is being put into places where their volume is growing, just like locums in the US is. Um, my next step with that was working with Doctors Without Borders, and they are a relief organization, have a little bit of development in their charter, but no capacity building. So there was no one. So I fell into a role because I wanted to leave a lasting impression, or I wanted my work to go exponential. Teach a man to fish, give a man a fish, teach a man to fish type thing. And what I found was no one was doing that. I would have loved to work for somebody else, but nobody was doing that. And so I became a liaison between when Doctors Without Borders was pulling out a project and the local Ministry of Health to bring doctors in and train them to what they needed to fill the needs in their own countries, using their own by their own cultures with their own resources. And that's what kicked off um, that's what kicked off my career. Now it's a huge difference from a mission statement, because a mission is somebody on the outside deciding that there's something that people need, maybe having a need, and not all really focused on that education, that capacity. You know, aid work in the world in my lifetime has been a huge quagmire of politics, and it's not straightforward whether things are helping or hurting. We'll just like leave it at that, but that's a whole different discussion and a whole different podcast.
Dr. Mohr, if I was to ask you, like looking back on the 18 years that you've been doing this domestically and abroad, what would you say is the most impactful experience that you've had as a locums physician? What comes to mind when I ask you that question?
I think, well, the background, I guess the background positivity is what we do for patients. And we can say that that's a backdrop for everything we do. But I would say walking into, a busy OB center and just seeing a colleague who is just at their wits' end with the amount, say they had someone go on maternity leave, or, someone had a change in situation and they're just exhausted. And they look up at me and they're like, oh my gosh, thank you for being here. That type of camaraderie with my fellow physicians, like, although it's brief and it's not like working with somebody, day in and day out and covering call in a private practice, I would say that's really, really rewarding, because it's like being able to give a hug to your colleagues in a way they really need it at the time.
Absolutely. When I first started doing locums about 11 years ago, and it might be unique to my specialty, but it seemed like there was somewhat of a stigma about locums from some of the doctors I would talk with. They would be like, this is something that people do that they that can't get a job. And now I think like there's been a lot of shifts, right? There's more demand than ever to do locums, and I also think that there's been some shifts as far as the values of our younger generation, where things like having more flexibility and freedom and being able to do things that you're passionate about is important as far as integrating with your career. How was it when you first started? Did you notice that at all in?
Oh my gosh. I tell you, when I first started, I would walk into some place and they'd be like, what'd you do? I'm like, what do you mean? And I would start, just telling people about me, and they're like, wait, you're not like, on death's door, about to retire, hands shaking, can't remember where, where you left your glasses, or, couldn't get a license, and that's what it was when I first started. And it took, I can say that I'm glad I had the global things to concentrate on in the middle of the practice, because I didn't necessarily see that I was paving the way for the evolution of this. And now more and more people ask me about locums. I think the condition of the U.S. medical system, where any employees of a large healthcare conglomerate, a business is a business. They want to get the most, for their money, and and that sometimes means overtaxing, physicians, nurses, all of the staff. And as we all sort through, this crazy system of ours and try to figure out how to make it better, things have changed because people's boundaries blessedly have gotten better, and said, I trained a long time to do this, and I want a quality of life as well. And I see people moving into locums because of that, and I'm really proud to see that evolution here in the States.
You certainly have paved the way for that. If and this is a good question that I love to ask too, because there are people that are listening to this that, or maybe they're in that position where they're just like, I don't know, I'm a little bit nervous to do this, but like what I'm doing right now isn't aligning with me, and I need the courage to take a step in that direction. What kind of advice would you give to somebody who is in that position? Maybe it's a message to the younger version of yourself too. Like, what would you tell the younger version of yourself, or somebody who is itching to give this a try, but maybe not quite ready, or not willing to take that step, but feeling that nudge? What kind of advice would you give to somebody?
I'll probably get a little little metaphysical, little spiritual on you, which is, if you love what you do, you're talented in it, and it gives forward to the greater good. Like, things fall from nowhere. Like, you never have to worry about where your next job, where your next paycheck are coming from. And I have to say, locums, I've had the privilege of, when those things align for me, I've never worried about I've never worried about where and when my next job is. I've never had the fear, the concern. The need is there. And if you're happy and content, and move move towards your own path that really satisfies your soul, it'll all be there right for you. And locums, and I mean, these recruiters, make it happen every day. And it's an amazing lifestyle.
I love
Just do
hearing
it.
that. Yes. Well, and to get a little bit spiritual or metaphysical, I think that decisions made from a place of courage and confidence have a much different outcome than decisions that are made from fear or worrying that things are going to run out. So I agree with you completely. There is just, like that it's a sign though too. If you're feeling that nudge, if you're feeling like out of alignment, it's a calling to maybe explore this a little bit deeper. Dr. Mohr, I have one more question for you before we wrap up, and I wanted to touch a little bit on some of the things that mean a lot to you when I asked you what's important about locums, or what you're passionate about, and we already talked about helping people around the world, but I wanted to touch on this. So you've been a career locums for 18 years. You said one of the things that you're passionate about is academics, high risk and high volume settings. How do you steer that? Do you find that you have enough opportunities that allow you to be in those settings? And tell me a little bit more about how you intentionally create environments where you can be working in those settings.
Sure. Well, I at first, it was I was told it wasn't possible. Academic institutions said, we only give uh, uh, academic appointments to full-time staff. And honestly, when COVID seemed to change that, and when the very first one, really needed help, and I said, well, I want an academic appointment. And, they were so desperate for help. They're like, okay, whatever, that's just paperwork. And so honestly was an open door. Like, keep your eyes open and your heart open, and look for where the doors and windows open in what you're passionate about. And so now, there are some really lovely communities that I love the physicians, and covering, small towns that I still take, weekend pager call. But I prefer being busy on 12 or 24 hours and running and having a full complement of residents, because teaching is what I do. And I just feel like every time, I'm called with something, I say, okay, is this moving me towards, what I enjoy, or away from it? And I kind of act accordingly. I'm not afraid to turn things down and be more explicit with, with Trish, who is, just has been the most amazing rep over the past 18 years about, what I do want, so she knows what she's looking for. Um, and I state, my needs. It's important to state your boundaries and needs, and have those respected.
Thank you so much. I love what you shared with me. And we've talked about a lot of topics that I haven't covered on this podcast. So this has been immense value to me and also the listeners. I want to say thank you so much for taking a little bit of time out of your day and speaking with me. Audience, if this has resonated with you, I would love it if you would share this with somebody else that might need to hear this message. Thank you so much, Dr. Mohr. And audience, thank you as well for tuning into this podcast. I will catch you on the next episode.